All right, welcome back to the podcast. I am joined today again with Dr. Jonathan Shedler. Welcome back.
Hi, it's good to be back.
And we will be discussing narcissism today. And so I was thinking maybe we could start out because I know there's going to be some professionals who listen, mostly professionals, but there may be some lay people that listen. And I know narcissism has kind of different definitions. There's the pop culture definition, every ex-boyfriend is a narcissist. There's
Yes.
like, and then there's the psychoanalytic tradition, which there's can be like healthy narcissism, unhealthy narcissism spectrum, all the way to malignant narcissism, more of like that psychopathic narcissist. So yeah, do you want to just start out with how you
Yeah, I mean,
differentiate
I
it?
think you already put your finger on something really important. This happens all the time with different psychoanalytic terms, diagnostic terms, that something, it gets consumed by pop culture. And then, all the clinical meanings disappear, all the nuance, all the psychological understanding disappears, and the word gets thrown around largely as a pejorative. And I did a little research. I just I googled narcissist, and it returned tens of millions of hits, and a lot of them were social media posts and blogs. And how to tell if your boyfriend is a narcissist, how to deal with a narcissistic boss, how to say no to the narcissist. And there were all these references to the narcissist, the narcissist, the narcissist. And I mean, as a clinician, it drives me a little bit crazy because there's no such thing as the narcissist. And, in most of these blog posts, it's like, you might as well substitute the word the boogeyman everywhere it says the narcissist, because it just becomes this, it's like this box that you fill with every negative, pejorative, thing.
Mm,
And I mean, it's funny because people on social media who are like, we shouldn't label people, we shouldn't use diagnoses, these are social issues. It's like somehow the narcissist is an exception to that, right? And then
mhm.
you could just you can just heap all kinds of, I mean, just all kinds of disparagement. So, anyone who's mistreated you, who's been exploitive, who's been insensitive, suddenly they're the narcissist. So
Yeah, and we don't want to negate someone who truly is, like if you have undergone abuse from someone who is narcissistic, when we'll get to like what we would consider
yeah, but
narcissistic, but we don't want to
and
negate that
that's the
experience.
issue. Most of the things that are abusive and exploitive that people put in the box and say that's the narcissist, most of it is actually not about narcissism at all. Right. So narcissism in popular usage,
Mm,
narcissism has become this kind of grab bag category that actually mixes a, a number of different things. Right. And
yeah.
right, and then the people stop being three-dimensional human beings. They're just the narcissist. So maybe we should talk about.
Well, before we move on, let me make my sort of what I've seen, and then I'm curious what you think about this. But a couple patients I've had, or friends, once someone, a boyfriend, husband, is labeled as a narcissist, it's almost as if it's like a filter in which they see all future behavior, thoughts,
Yeah.
statements, and all of the behavior, thoughts, statements, like anything positive is love bombing, is they're trying to be manipulative, and
Right.
everything negative is another example of their gaslighting, or
Yeah,
another.
and so we're not thinking psycho. I agree 100%. We're not thinking psychologically anymore. We're doing the opposite of thinking psychologically, which is putting someone in a box, right?
Well,
Right. And then we don't actually understand the meaning, the meaning of what this particular individual is doing, right? We just attribute every nasty thing in our box to them. And right, I think you're onto something important, because as a clinician, I think we always have to ask, are we using psychological terms or psychiatric terms or psychoanalytic terms, are we using them in the service of facilitating our psychological understanding of someone, right? How do I make sense of this person's, how do I make sense of this person's behavior? What's going on with them psychologically? What's motivating it? Right. How do I understand them as a person? So are we using terminology to help us think about a particular person's psychology, or we're using terminology in the service of not having to think about it anymore? And that's really kind of doing violence
Hmm.
to the work we do.
That's good. Yeah. So it's like a form of like reductionism, and then you don't have to do your own work, right? Because if someone else is the problem, idealize your own experience, thoughts, emotions, fantasies, internal structure, and then
Yeah,
vilify the other person.
yeah. I mean, if we're going to get technical about it, it's at best it's externalization as a defense, right? If you're in a relationship with someone, if you're in an ongoing relationship, it's very complicated. There are two people psychologies in the mix. There are two people psychologies interacting. Um, it's very hard to disentangle what's what. And as soon as somebody becomes in the relationship, the narcissist, or even worse, I mean, I see this on Twitter all the time, the narc, I mean,
Mm,
really dismissive. The externalization is, I don't need to understand anything about myself. I don't need to examine my own contributions or reactions or you know what's going on in my psychology that drew me into this and keeps me in it and keeps it going. Right? The externalization as a defense. All of the problems are outside. Oh,
mm,
right. What I do is not reflected on, and anything that I feel, don't feel good about, well, it's somebody else is doing, and that's the higher level defense. Right, the lower level defense is splitting, where it's like I don't see the bad, right, the destructiveness in myself, and I split that off. It's a very primitive defense. I project it onto the other person, and now the other person becomes the repository of all of my own, you know, hate and anger and aggression and destructiveness. It's not me, it's them. And sometimes people who are organized around splitting as a defense need
mm.
somebody, bad in their orbit, um, to be the repository of the things that they can't own in themselves. So things get very complicated in the real
This,
world.
yeah, this is where it gets complicated. So if you're listening this far and you haven't, and this is bothering you, that's okay. Um, because we have to. I wanted to almost put this as a disclaimer before we jump into it, because this will kind of make people a little bit more hesitant to maybe point the finger at some relative or their spouse or relationship, and and realize that we're using this in a clinical sense. And so maybe let's, if you're ready,
me or our listeners.
if you're ready, um, okay. So how do you clinically define narcissism?
Okay. So one thing that we have to understand, every personality style, and narcissism is a personality style among many, you know, narcissistic personality style, obsessive compulsive, paranoid, just walk through all the familiar personality styles, exists at different levels of organization, at healthier levels and at more disturbed levels. Psychoanalytically, we differentiate between neurotic level functioning, borderline level functioning, borderline organization, not borderline personality disorder, and psychotic level functioning. And like every other personality style, narcissistic personality style exists at all of these levels of functioning. Most of the bad, the really, destructive, the toxic things that people associate with narcissism are actually not about a narcissistic style. They're actually about a narcissistic style organized at a borderline level.
Mm-hmm.
Like people talk about, gaslighting. That's not actually an inherently narcissistic thing to do. It's a thing that happens at a borderline level of organization for psychological reasons that we can understand. So with that as a preamble, every personality style has healthier and unhealthy variants. What does healthy narcissism look like? You need you need healthy narcissists in the world, because they're the people who dream the big dreams, who have the grand visions, right? They're innovators, they're founders, they're charismatic leaders. They're the people, where they have some grand idea, and anybody else, an internal voice in their head or external voices, or no shortage of external voices, says, these are pipe dreams and your head are in the cloud, and be realistic. And they give up on their dreams,
Mm.
right? And somebody with healthy narcissism believes in themselves enough to do it. And if they're, if they have some interpersonal charisma, right? They're the visionaries. They gather people around, who, they gather people around who want to be part of it. They can do great things in the world. You could, um, I've heard it argued that, the world is run, when it's run well, the world is run by higher functioning narcissists.
Okay, so let me like translate this for maybe someone who's confused. Um, the defensive style of someone who's narcissistically oriented is fantasy, and kind of that grandiose fantasy of like something that could happen in the future, right? And they may believe in themselves as
but
more
they're
than maybe the
connected
average
enough
person.
to but they're connected enough to reality, and they're interpersonally related enough that they have the capacity to translate that into doing something meaningful and effective.
Yes. Okay.
Now,
So
I'm
that's
not gonna name names, but if you think of some of the major tech companies that kind of started with a charismatic visionary that are household names. I mean, a lot of those people are fundamentally narcissistically organized.
so are you saying that with if you have fantasies of grandeur, like a vision for the future that you're trying to accomplish, that in and of itself would make you narcissistic, or like what are you saying there? Or
No,
like is
I'm
ever
saying that the healthier version of narcissism is somebody who believes in themselves,
okay.
who who has the ability to persevere despite setbacks that would discourage other people and make them give
Mhm.
up. Where people say, well, who are you to do this? What's so special about you? And somebody who's functioning at a healthy level of narcissism might say, well, I think I can do this, and I'm going to try.
Okay.
To that we can distinguish from an unhealthier version of narcissism where the grandiosity isn't connected to reality. You should treat me as special and grand, not because of what I actually have to offer, not because of what I'm contributing to the world, not because of what I have built or am building. Right? You should treat me as special and important and grand on the basis of my fantasy that I should be treated that way,
Mm.
as if I've done something great, as opposed to I'm actually I'm actually trying to do something great and I'm making some headway at it. So
O-
I
so
guess what I'm
if
saying
there's a
is,
huge disconnect between reality and
yeah,
um okay.
there's a recent book by uh, Glenn Gabbard is one of the co-authors, and this phrase that they use in this book stands out in my mind. And he says, it's a book about narcissism, but he says, let's just set the stage from the beginning. There's no such thing as the narcissist. It's not a monolithic category. It takes many, many different forms. And he says narcissism clinically is a many-headed hydra, which I think is a wonderful phrase. Right? It sort of leads us to start thinking about, what am I seeing in this instance in this particular person, and what does it mean, rather than a box to put people in.
So, okay, so in your chapter on narcissistic personality, you say the hallmark of narcissistic personality is the coexistence of feelings of grandiosity and feelings of inadequacy and emptiness. So I guess I'm curious, like this sort of other side. We've talked a little bit about the grandiosity or confidence and like more of a
Okay.
healthy
Yeah.
oriented
So
person.
let's get into that. And even the DSM actually gets it wrong. I mean, it kind of misses the most important thing. The DSM is not a particularly psychologically minded document, especially when it comes to personality. So what we know clinically and from empirical research, including my empirical research, right, the defining hallmark, it's not just that the person feels, is grandiose, self-important, entitled, right? That's one that's one side of a conflict. Right? The theme is actually that there's a tension, there's a contradiction, that the person simultaneously feels special, grand, important, envied, superior. And there's something in them that feels the opposite of all of those things, that feels damaged, weak, inferior, empty, right? Vulnerable. So it's not that somebody with a pronounced narcissistic style is one or the other. It's the tension, it's the interplay between these two contradictory ways of experiencing themselves, and what becomes of that, right? How that contradiction is resolved, how it plays out. And so the grandiosity is compensatory, right? These are defenses against underlying feelings of weakness and vulnerability and fragility and emptiness, right? And the person is trying to banish those
Mm.
feelings, right, by inflating themselves. So what you see in somebody with a narcissistic style at any particular occasion really depends on, the interplay of these two sort of, contradictory facets of experience, and how they're finding expression at a particular point in time. So now this brings us into the area of, closer to what people in pop culture mean when they say, the narcissist. Usually they're talking about the narcissist whose narcissistic defenses are functioning, are functioning and are pretty airtight. And they're succeeding at keeping at bay their feelings of vulnerability. Right. So the grandiosity and the self-importance, um, helps to keep out of awareness something that's very, very vulnerable, right? Something that's in pain, right? Feelings of emptiness and inadequacy. So if you talk about one side of narcissism, we know that the other side is here. And now this brings us to two different manifestations of narcissism. One is the grandiose narcissist. The defenses are intact. All you see is the self-importance. And various things follow from that. One is the person really doesn't have mutual relationships with, genuine attachment and connection. Mutual meaning that two people two people matter in the relationship,
Mm-hmm.
that the person has, empathy for the other person. They care about the other person. Right? The grandiose version of that, relationships become damaged, intimacy and connection becomes impossible because other people become an audience, right? They're not there as, as whole human beings in their own right, right? They're there to be an audience to the they're there to be an audience to the person's magnificence and importance and specialness, right? And right, so you're there to bolster those defenses, and if you serve that purpose for them, well, then you have a role in their life. If
Mm-hmm.
you don't serve that purpose for them, then you can be discarded.
And you cease to exist. Yeah. Yeah.
So that's one side of it. I mean, what happens when the narcissistic defenses are working and they're intact, right? And we see a lack of empathy, a lack of relatedness. Other people are used to serve a function, which is to prop them up. The other side of it, when the narcissistic defenses are failing, you don't see anything that resembles what's described in the DSM. You certainly don't see anything that's described in social media and blogs on the topic. What you see is somebody who looks beaten down by life, who's deflated, who's
Mm-hmm.
you broken down. When they come to therapy, you know, they usually come in, they look depressed, and they get diagnosed with depression. And some not insignificant number of people who are in treatment for quote unquote depression are actually deflated narcissists, right? Their narcissistic defenses have failed, and they're coming just face to face with their feelings of being beaten down, taken advantage of, put upon, of failure, of weakness, of vulnerability. Our hearts go out to them.
Mm-hmm.
And the way we make the differential diagnosis, is this depression, is this another kind of depression, or is this a deflated narcissist? It's when you get below the surface of their pain, do you find out is that their mental life is largely organized around fantasies of how special and important they are
Mm-hmm.
or should be, and how the world is doing them wrong by
I see.
not recognizing their talent, their ability, their importance, right? Right.
Right.
Um,
Right. And I would say like vacuous. It's like interpersonally broken relationship after broken relationship. They don't have long, meaningful friendships
no, and
often.
and they're the central, right? I mean, we all tell ourselves narratives about ourselves and the world. The narratives are always, they're always the hero of the narrative. They're always the central character. And I'll just give you kind of, it was amusing, a kind of, on the one hand, sort of trivial and silly example of what deflated narcissism looks like, but on the other hand, actually not silly at all, because it really captures something central. Um, so a person has a house guest, and the house guest notices they wash the dishes, and they leave the sink they leave the sponge in the sink, and
Mm-hmm.
the person who you know we now understand is functioning from a place of deflated narcissism says, oh, that's a no, germs, you should take the sponge out of the sink and wring it out and let it dry out, bacteria grow, which I think is true. But and but of course, it's hard to change a habit. It's not like somebody tells you that, and then
Right.
automatically from that point on, you never put the sponge in the sink. Well, so the next day, sure enough, the damp sponge is in the sink, and the reaction is, "How could you think so little of me? You have no respect for me. You look down on me. I told you this is important, and you're disregarding me. Right? It
Mm,
becomes all about them. It's not about the sponge and the sink and the dishes anymore. It's
right.
about,
It fits the
now they have a
narrative.
grievance. You're wronging me. You're putting me down. Right. So when I say, they present as likely depressed, beaten down, aggrieved, when you scratch the surface of it, they're still the hero of all the stories. It's all
Mm,
self-referential.
yeah. The victim at times, and the hero most of the times, right? Like
You're the hero, or you're the, unsung and unrecognized, and and mistreated hero. Recognize that you're supposed to be the hero.
yeah. And so I think this the sponge example is kind of like they have this deflated sense of self that's in there. And then a little thing like a sponge can align with their narrative of themselves, the way they see themselves.
It's a personal slight. It's not a sponge anymore.
Yeah. Yeah. So it kind of like fits into their global, idea of themselves.
Yeah, and I want to emphasize, because and especially in popular culture, it's just seems like it's become the norm that we're going to vilify these people. And a lot of people who have narcissistic styles, narcissistic organizations, suffer quite a bit. Their lives are not fulfilling. They don't have meaningful connections, with others, which of course is ultimately what makes life meaningful and worthwhile, right? Right. So they're kind of bereft of meaningful connections with other people. That face it. I mean, life is hard. Life can be cruel. We all get our share of hardships. It's our connections with other people. It's our meaningful connections
Mm-hmm.
that make life meaningful and make life worth living in the face of all of the hardships.
Mm-hmm.
Well, if you take meaningful connections out of the person's life, they're a miserable, they're a miserable, suffering person.
Yeah.
And I think, to treat them as, to treat them from the get-go as, the villain, you know, you're the villain and you're victimizing other people. I think it's just really not understanding the psychology of what's happening.
Yeah. I think the self-referentialness of like someone who's kind of narcissistically wired comes out as well when you're working with someone, is how much do they think of you or care about you. The person that's, are you like a trash can that they heap their
Yeah.
horribleness into? Um,
Well, and right, and so that would be the more inflated side of the, inflated, deflated conflict. And
okay,
that
go
would
on.
be moving into the more disturbed areas of narcissism, because you can have somebody who's narcissistically organized, who is capable of connection and caring about people. And arguably the difference between, I'm not sure whether or not I agree with this, but a strong case can be made that the difference between a healthier and a, more disturbed version of the style, it isn't so much the presence of, primitive or costly defenses, but the absence of, healthier capacities, right? So you can be kind of narcissistically organized, self-important. You tend to, you tend to be the main character in your story. But if you're functioning at a healthier, higher neurotic level, and for, listeners who don't know, I mean, thinking in psychoanalytic terms, neurotic is as good as it gets. Neurotic is the
Yep.
healthy level of functioning, right? Say maybe narcissistically organized, but they have the capacity to invest in relationships with other people, right? They can care about other people, right? They can have empathy for other people, right? That's the higher functioning version of
Yep.
narcissism. And
When I
the other person can say, it felt really shitty when you did this or that. And, there's a reasonable chance that they can hear you and take that into account because they do care about you. As we
Mhm.
get into the sicker ranges of a narcissistic style, they actually don't care about you except to the extent that you provide narcissistic supplies, which is to say, a sort of a constant, a constant feed of approval, admiration, validation in the service of propping up this person's inflated but very precarious image of themselves.
Yeah, and what I was going to say is I think the sicker narcissistic type for me is the type that has some psychopathy, and by psychopathy I mean like specifically low affective empathy.
Well, let's
And
get into the sicker kind because we've been at the on the
okay,
healthier end of the spectrum.
okay,
I also want to elaborate on something you said about what it feels as you get into a relationship with somebody in the more disturbed narcissistic range. As a clinician, one of the experiences that's very common, our first indication of what we're dealing with is often in the countertransference. And I think you were trying to describe a particular kind of countertransference that's really common, which
mm,
is we feel like we're not really, that we're not really there in a relationship and,
mm,
being seen as a person in our own right. We're there to serve a function. And there's a version of that experience. I named it the beam me up Scotty experience.
okay,
And people who watch the old Star Trek, there's Scotty on the Starship Enterprise, and he had this teleporter, and what you could do is there'd be somebody down on the planet, living their life, and you just send this beam, and they would just disappear. They would just be beamed off the planet and
right,
put back in the ship, and you could beam somebody else down to the planet. And the what I call the beam me up Scotty experience is you're the clinician or you're in a relationship with the person, and you have this sense that if Scotty on the Enterprise beamed you up out of your chair and put somebody else down in your place, you're not sure the patient would even notice.
mm,
Mm.
okay, yeah. So it's like this idea. Okay, so as the therapist, you're imagining like, is there anything about me that is not replaceable very quickly?
Is there anything about me that you know that is there anything about me that allows me to feel that I matter as another person
Right. Yeah.
and not just as someone who's serving a function, a purpose for them in the moment, right? And when you get into the sicker range of narcissism, then relationships become very transactional, right? Because they're not based on empathy or mutuality. They're based on, what do I need from you? What do I have to give you to get what I need?
Yeah. It's like I've been to some business parties where it's like you kind of have this feeling like everyone in there is just trying to be polite, but at the same time trying to like see how they're going to utilize other people to accomplish what they want, you know, and you kind of get that feeling. Um,
Yeah, the feeling is that you're being used for
yeah,
something. And in therapy, it's that we have the beam me up Scotty experience. We have the experience, all this is countertransference of existing as a sounding board. The patient wants you to listen to them, right? You're going to serve the function of being an audience, but they're not particularly interested in you participating or what you might have to say about it.
yeah, and I feel so. I think I'm curious if you've seen this. May be like jumping too far ahead, but patients that come in more of the depressed narcissist type, the deplete narcissist, and then they start doing better, right? Maybe like life goes well and you've done a little work together, and now they're doing better. And they make jabs at you almost on the way out of therapy, where they're like,
Mm.
thank God you got that genetic testing done, like like because I'm like, no, but you did like a year of therapy. Like, I don't think it was the genetic testing that helped you, like, change your dreams.
Well, there's
Um,
two characteristic, three actually, two major characteristic kinds of transference in therapy. Um, Transference and a corresponding countertransference. And one is that the patient is overtly devaluing, right, which tends to leave therapists feeling bored, disengaged, angry, wanting to put, they either want to, kind of withdraw and just, emotionally disconnect, or they want to retaliate and put the patient in their place, because the patient is putting them down. So
mhm.
that's one, and of course, none of that acting on that countertransference isn't particularly helpful to the patient. Right? The other right? So one countertransference is you're on the receiving end of a lot of devaluation, and what you
Mm.
said, a lot of like subtle and not so subtle digs,
Yeah.
jabs.
Yep.
The other
Yep.
countertransference is right. So you're devalued. The other is you're idealized. You're seen as very important,
Hmm.
special, larger than life, but it's not exactly just reality based admiration. I mean, the patient wants to see you in this idealized way, so they can feel better about themselves by their association with you. My therapist is the best, the smartest, the
Mm.
highest credentialed. They went to this program, they make this amount of money, they treat stars and celebrities. It's not really about you. It's like, if I'm your patient, I get to feel a little more important by virtue
By
of my
connection.
association with something so special. But the thing about both of those transferences, the devaluation and the idealization, is that neither of them have a lot to do with who you actually are. Right? By definition, devaluation is I'm not seeing you as a whole three-dimensional person as you are. You know, I'm seeing you through a certain set of lenses that serve my purposes, and isn't really about you. Same with the idealization. It's not about who you really are, getting to know you, experience you as you are in the session. It's about I need to see you in a certain way through certain lenses, because that serves a function. And then often
Mm.
patients will go back and forth, right? They'll alternate between idealization and devaluation.
Yeah, I've had this patient I've treated for years. And he went from jabs, like, and devaluation jabs that would sting, to now true concern about me as a person and about my
So
family, or about, like, and it's almost like,
oh, they're
it
changing.
surprises me. It
You're helping them.
surprises me. And it's it's been a long time coming. Like, I don't know, like, I'm definitely, like, I like to see the end of the story, so I stay with people for a long time if they're willing. um Go ahead.
Yeah, and this is really important, right? So I mean, this is significant change. Whatever you're doing doing good work. What people who aren't trained in psychodynamic therapy often don't understand is the importance, the centrality of the therapy relationship. So, like, the goal of therapy isn't so that the patient should have a better relationship with the therapist. That's not why the person has come in. But the thing is, the person, I mean, the fundamental problem is, here's somebody who in their life doesn't know how to have a relationship that works for two people, right? That two people can feel okay about, right? Doesn't know how to have a relationship where they even register that the other person is, also a whole person with their own inner life, you know, their own life experiences, their own difficulties, their own feelings. I mean, the idea is we work it on it in the therapy relationship. It starts in the therapy relationship because that new way of experiencing self and others can then carry over
Mm.
into other life
Yeah.
relationships. Right? If we can make some headway with the narcissistic defenses that get in the way of seeing you as a person, as a whole person, you know, then the likelihood that they can start to see their husband, their wife, their
Mm.
friend, their, you know, coworker, you know, the likelihood they can see them as real people changes, dramatically.
Do you kind of see what Kohut was talking about, like the mirroring, being attuned, giving them the empathy that they need, kind of like meeting that um, in a way that's maybe
Well,
more truthful than
yeah. So,
childhood? Like,
so,
where do you align with that?
uh, God knows it was such a such a tempest at the time. So in the psychoanalytic tradition, there was a kind of war that went on for a decade or more. And the two major theorists around narcissism were Heinz Kohut and Otto Kernberg. And Otto Kernberg's still alive. Um, they had radically different views, and this is a gross simplification, but basically, Kohut believed that the treatment for narcissism was empathy and understanding, mirroring, which is that the patient has a need to be admired, and we provide that admiring. So basically, Kohut saw it as a developmental deficit. It's a tongue
Mm-hmm.
twister.
Yep.
Um, that the person didn't get something that they needed from their primary caregivers in childhood. The therapist can provide that for them:
Mm-hmm.
empathy, attunement, understanding. And by virtue of getting that the person would naturally, sort of resume a developmental trajectory and grow beyond that. Like, Kernberg was dealing with narcissistic patients who are actually much more disturbed, who are much sicker. And he was dealing with borderline functioning level narcissists. I think Kohut was dealing with much healthier neurotic level narcissists, narcissistically organized people, um, who I think they were dealing with different. I think they were different
Yeah.
animals. I
Yeah.
called them both narcissism, but they were
I
different people.
that would actually be my intuition was to think that Kernberg was seeing a little bit more of the low affective empathy group that
My under,
needed a little bit more truth and that respond to truth. Someone who's a little bit more of a killer, you if you just kind of bluntly tell them what they're doing and how it's messing up their life, and you're strong, they sometimes they respond with like, oh, okay.
well, I think Kohut was working with students and
Okay.
analytic candidates, right? So these were sort of high functioning people, um, who are dealing with a sense of emptiness or meaninglessness or a feeling of, there's kind of incoherence, like, who am I really?
Mm.
Which is very different from what Kernberg was dealing with, which is where I was wanting to get to this.
Okay. Yeah.
When we get into narcissism of the kind that would get a DSM diagnosis of narcissistic personality disorder, we're already at the borderline level of personality organization
Mm.
organized around splitting. And then something very different is happening. And this is, we get into pop culture, all the horrible things that narcissists supposedly do. This is the kind of narcissist. But we have to understand, we're also seeing a borderline personality organization, which is to say organized around splitting. So how does the splitting work? First of all, the person isn't actually experiencing this conflict between feelings of vulnerability and inferiority and feelings of grandiosity. They develop really airtight defenses, and Kernberg calls it the pathological grandiose self. And the airtight defenses are that all of the negative feelings, the feelings of inadequacy and inferiority, get dissociated. They get
Mm,
split off, right? Not me. I'm not aware of these feelings in myself. They get split off. They get projected onto somebody else, right? Who becomes the repository of all of the inferiority. And having done that, right, through projection, I can now proceed to treat them as inferior, right? So they exist as, objects, you know, objects to, that exist for my satisfaction and my pleasure. I mean, devalue them, right? So you take all of the idealization and right the sort of
mm.
idealized
There's just
representation of yourself.
you said you
That's you. You take all of the things that the parts that are devalued, they get projected onto someone else, and now you can treat them as inferior and treat them with contempt. And now we start getting into the range what people on social media blogs are calling the narcissist, right? Let's be clear, this is one particular
mm,
version of the many-headed hydra of narcissist, right? And the defenses are really airtight. you know you're treated as lesser than,
mm.
and if you try to interact with them, you feel that.
You've
um,
yeah. A couple of things I note as you talk: that devaluation, microexpression of disgust, and then the last line you had some anger. It's like you have lived. See, I think most people when they like it's so hard to think about psychology until you've seen like probably I don't know, you've probably seen like 50,000 hours of patients at this point, maybe 40,000, right? And so it's
Easily.
like, and so you have these patterns in your brain of this type of stuff, and you have the years of experience, and then you're reacting emotionally to it. So if you have a chance, go check out our YouTube on this as well. And but it's like, there's like you can't not have countertransference to someone devaluing, and
and you
someone,
have to and you have to use the countertransference, which means not doing what comes naturally. This is our training. This is why we have personal psychotherapy and personal psychoanalysis, and and supervision, consultation with senior colleagues. Because the pull is,
mm,
the patient, treats us in this devaluing, dismissive, high-handed way, and the pull is either to slap them back, fuck you, I'm more important, or to disengage and withdraw. We
yep,
become bored and lose interest in them. And working skillfully with a patient who functions this way, is, first of all, we want to say, what's going on between us? What's going on interpersonally that's evoking these feelings in
mm,
me? You know, and and instead of either, trying to put the patient down or disengaging with them, can I address and speak to what's going on between us, right? And can I do it in the context of, they didn't come to therapy for sport, they came to therapy because something is broken, right? So we always want to be able to, I'm digressing a little bit, but when a patient comes in for therapy, we in the very first session, we really want to know three things up front. What's wrong? Why have they come? Right? I'm just going to repeat that. The patient
mm,
didn't come for sport. They came because something in their life hurts.
mm,
Something is broken. Something is causing suffering. We need to get that on the table. That can take a lot of work with somebody who's narcissistically organized, who may well come in with the attitude, I'm fine, let's talk about what's wrong with you. Right? We have to get to the pain. So we want to know three things: what's wrong? How are they hoping that therapy can help? And why now? Because something has happened that's tipped the scale, right, in the direction of coming into treatment now, as opposed to years ago or a year from now. If we have that as a starting point, then we can keep our eye on the ball. The
mm,
patient has come in because something is wrong. We've reached a meeting of the minds about what goes wrong. I mean, commonly it's the patient is, you know, their relationships feel empty. They can't get close to people. There's an emptiness in the background, just under the surface, and it's not really that hard to access. So, maybe that's the reason. We hold that in mind as we think about what our reaction is to them. And then we can connect it to what matters to them. We can say something like, I'm thinking about why you came in, and what brought you to therapy, and I'm thinking about how you told me that your relationships all seem to fizzle out and don't go anywhere, and that you're ultimately left feeling alone. Right? Yeah, I said that. It seems very far. It seems very far away at this moment, doesn't it? It's like, well, yeah, I'm not feeling that way right now. But there might be something happening between us that that might help us understand something about why your relationships fizzle out or never get traction, don't seem to go anywhere. No, because I'm noticing, I'm noticing there doesn't seem to be a way for me to participate in our relationship, in this session, in a way that feels all right to me. What do you mean? we want to use the countertransference. So, I think, you've let me know multiple times that I'm not quite up to snuff. Oh, I didn't mean it that way. Well, you said this that left me feeling that way. You said that left me feeling that way. Do you see how that might land on my side of the relationship? Oh, I didn't mean it that way. No, perhaps not. But it's something that's been in the air here between us. And, we both know it's not just us. Right? We know that something goes wrong. And when you try to have relationships with other people, maybe this is a little window into that something. It's a way of working with a certain kind of narcissistic defenses.
I appreciate it because you put it in terms of his goal, his or her goals.
Well, if we don't do that, there's nothing in it for them. Right? It
Right.
has to be tied to, why did they come to treatment?
What is their pain point?
Yeah.
What is their reason that they're here? And then it's like, well, what if what's going on between us is a little,
A little
hey,
window
little window, and we could talk
into
about it and be
how
curious
things
about it.
go generally.
Yeah.
And then you might be able to get to a point where say, it seems like something happens, between us, and of course not just between us, where somebody has to come away feeling lousy, either you or the other person, but somebody has to feel bad about it. Do you see? Do you see how that's playing out here? And so we want to, keep inviting their curiosity and stimulating their curiosity, always keeping our eye on the ball of they've come because something is hurting. But let's you had asked, I want to make sure we talk about this before we run out of time. You asked about the malignant narcissism, the really disturbed.
Let's talk about malignant. Yeah.
Most of what people are writing about on social media, the narcissist, exploitation, gaslighting, Darvo, blaming other people for everything. It's actually not about narcissism. It's about malignant narcissism. And malignant narcissism is really the place where narcissism starts to shade into outright psychopathy. Mm-hmm. Like, so clinically and empirically, we know when we start talking about malignant narcissism, there's really an overlap between these groups, right? I mean, a psychopath is somebody who is out for number one And basically their only real pleasure in life is in getting something over on you, right? Power for its own sake, not to
Yeah.
do something good, not in the
Yeah.
service of any other goal, just for its own sake. Power, dominance, cruelty, sadism, right? That becomes the chief source of pleasure, right? When we're talking about a psychopath.
Yeah.
And people are using the word narcissist when they mean
That
psychopath. Yeah.
is
And it's
sadistic
not about
aggression.
narcissism, it's about psychopathy. So you can think of a spectrum. There's the kind of narcissism that we've been talking about so far. At some point, there's no ability to invest in a caring way in anybody else. And our relation to other people, to our objects, to use psychoanalytic language, is just suffused with aggression and sadism. Right? Other people exist to be, so that I can lord over them, and take advantage of them, and toy with them for my own sport.
Mm-hmm.
Right? And right, that's the intersection of the most severe kind of narcissism with psychopathic personality. Right? That's a very small subset of the narcissistic spectrum. And then there's actually debate about whether people in that range can even be treated at all. I mean, there's some general consensus. There's some debate here too, but somebody who's truly psychopathically organized may well be beyond the reach of psychotherapy. And the more that somebody with malignant narcissism, the more psychopathic they are, the less likely that they can be reached in psychotherapy.
Yeah. I think you're right about that. I think it's like, first of all, they usually don't come to psychotherapy for, like, I want to improve my relationships. Because people are like cockroaches to them. People are like, inanimate objects.
And that's really the psychopathic version.
Yeah.
And I'd like, for listeners, especially listeners who are not in the field. I mean, this is such an important distinction, because if it's just like all over Twitter, the narcissist, the narc, most of the time they're talking about either psychopathic personality or borderline personality. And borderline personality is about splitting, and all of the badness is in someone else. It's in you, not them. So you get blamed for everything. Then we get into what gets called, and these are not clinical or psychological or psychoanalytic terms, but what's popularly called gaslighting. Then we get into gaslighting. If it's not done consciously for manipulation, if it's done consciously for manipulation, then it's psychopathy. If it's not done consciously, if it's done automatically, unthinkingly,
Mm-hmm.
unconsciously, gaslighting is a function of splitting and projection. I did something bad with consequences that hurt people, but like, oh no, I'm only good. Any badness that I might experience or perceive at all is dissociated, which is a split,
Mm-hmm.
projected onto someone else. And I'm going to blame you for it. And I'm going to blame you so effectively that you start doubting yourself. It's like, oh my God, I thought I did the right. Maybe I did something awful. Like, am I this horrible, monstrous person that this person is making me out to be? Like, God, like maybe I am. I didn't realize about it. Right. So you start second guessing yourself. That's the gaslighting part. The gaslighting is like, just like describes a social phenomenon. I'm trying to describe the psychology of what we see in very severe borderline level narcissistic conditions that gives rise to the experience that we might then call gaslighting.
That's good. Yeah. I kind of see it as like, you have a very confident assertion from someone, because of their defenses are guarding themselves so tightly that they are all good so they can't be bad. So you have to be bad. And so they project that confidence. And if you are a empathic human being, like most therapists, with good mirror neurons, you feel
You start to feel it.
you feel that confidence and you question yourself.
And that's the projective, right? So there's a difference between projection, which is I can't see something awful in myself. I see it in you. You're that person. That's just projection. What you're describing is projective identification. And projective identification takes it a step further, which is I don't just project the badness onto you. I treat you in such a way, and it can be super subtle. I treat you in such a way that I can actually elicit those feelings in you. So, right, it's not just that I'm seeing you, you know, seeing you and treating you as if you were some, horrible monster. I'm going to interact with you in a way that actually gets you to feel like I'm an awful monster. And you have to, it takes a lot of work on the part of a therapist. This is again where our consultation and our personal psychoanalysis comes in. And it's like it takes work to work ourselves out of the position of thinking the other person's thoughts and feeling their feelings, and back to a position where we can start to think our own thoughts again.
I can reiterate that. I think if you are a psychiatrist therapist and you're seeing someone and they are evoking their own world in you powerfully. I mean, that's like psychoanalytic work, right? If you're seeing someone 3 times a week, they will evoke a lot of stuff in you.
And that's a borderline level of personality organization.
That someone who does that to you? Or isn't that
because at a neurotic level, you can say, something that I just said, or something we just did, is stirring up the kind of feelings you had when your mother did, XYZ to you. It's stirring up those same feelings that come from there. We're basically interpreting transference. And the patient sees it as transferential. They're like, yeah, okay. I mean, I know you're my therapist and you've actually been really helpful to me. And I do know you have my best interest at heart. And like you're really tapped into some feelings that, that come from elsewhere. Right. So there's a kind of an observing ego. There's the ability to, to consider the possibility that the intensity of the feelings is coming from somewhere else. It's not just about you. Versus at the borderline level, no, you are exactly like my mother, my bad mother.
Right.
And, God, what a disaster that I ended up with a psychiatrist, who's just the same kind of rotten person my mother was or my father was, right. The self of the observing ego disappears, and it's now a fact. You really are that. And to use the language of Fonagy's mentalization based therapy, there's a collapse in mentalization, and my thoughts and feelings are now in my mind synonymous with actual reality.
He calls it what? Psychic equivalence.
Yes, he does.
Like my world is now your world, right? Like,
I feel hurt. You said something and it was hurtful. Therefore, it's a fact that your intention was to hurt me.
Yeah.
And in fact, your intention was to hurt me because you're getting off on hurting me, because you enjoy hurting me, right? And any shades of gray and nuance just are gone, right? Psychic equivalence. I think it, I feel it, it is therefore true. And this would take us very far afield, but there's an awful lot of that going on in our culture at this particular juncture.
Splitting? You think the US is doing any splitting?
I feel I feel a certain way. Right? I feel mistreated in some way.
Okay.
Therefore, it's factually true.
Yeah.
That you are a bad person and you are victimizing me. There's no differentiation between a feeling on the one hand and what may be happening in reality on the other.
Got it. Yeah. You intended to be sadistic towards me.
Yeah.
Therefore, you are sadistic, narcissistic, horrible human being. It's like, whoa, I just left the sponge in your sink. Like,
that was a nice bringing it full circle. Exactly.
I apologize.
It wasn't you're a sadistic human being in the case of that particular example. In the case of that particular example, it's like you don't give a shit about me. You don't care about me. You're completely contemptuous toward me. And
No. You are leaving that in the sink after I told you to torture me with germs. It's sadism. Okay, I'm changing your story. It's okay. But
the version you're telling is a version that happens. And if we're getting into the borderline level of functioning and mentalization collapses, right, then the projection becomes a fact. It can no longer be considered as at least in part, plausibly a projection, something I'm bringing.
And this is where it's so hard. One of the tortures is when you're treating a patient who continually goes back to that. Like, let's say they are in a very abusive situation, like how many average domestic violence leavings does someone have to do before they leave? Maybe it's like 9 or 11, sometimes it's like less, sometimes more. But when they go back to that and they get like almost like reprogrammed that they are all bad, and then they come back to you, and then you're like faced with this like, okay, wow, this person just went from some form of psychological health to like, once again, complete devaluation of themselves. Yeah. Torture. But I'm there for it.
I can tell you've been there.
I'm like, I'm in it for the long haul. Let's go. Hopefully,
but I mean, that's getting into a borderline range of functioning already. What you're describing, I mean, one of the things we know, if there's any big, grand takeaway message, people are complex. We have contradictory feelings about everything. People aren't, heroes or villains. People are human beings. We exist in shades of gray. Everybody, has the capacity to be destructive. Everybody has the capacity to do good, to be caring, to be loving. We're a mix, we're a bundle of contradictory motives and impulses. And, if we're trying to be self-aware, trying to become better human beings as we go about things, so we're not shutting out our capacity to do harm, or our pleasure that we might take in cruelty. We're not pretending or dissociating and saying that's not me. What we're saying is, I feel those impulses. I have fantasies. I have thoughts. Fantasies are free. Fantasies are not the same as acting on it. Fantasizing, about paying someone back is a world of difference from actually setting out to pay them back, right, for my own, my own pleasure and revenge. When somebody gets in the kind of relationship you're describing, and somebody is the abuser, and all of a sudden there's no aggressive or destructive or cruel impulses in them, right? Then there's a lot of distortion going on. Now, it may be true. Perhaps they're actually objectively in an abusive relationship, but it also serves a function psychologically. I don't have to reckon with any of the badness in me. The badness is in that person. And then you ask the question, well, you try to pry them out of this abusive relationship for their own safety and well-being. and often they go back, right? And then you have to ask psychologically, why? What is it? What is it doing for them?
Hmm.
And then there's a lot different answers, but one answer is some people require, they need to be in the presence of something evil, because then we know that the evil is located there in someone else.
Mm. Okay. I think as well, this makes me think about like our own countertransference to working with clients. It's like, yeah, you may have anger, disgust, your own your and I would say if you are a human being who does not have any access to your own anger, you're probably needing to do some deeper work, right?
You're
Um,
probably not going to be a very good psychotherapist.
so I think it's really important to as well emphasize, like, yeah, if you're working with clients who are on the borderline spectrum of functioning, this is or borderline personality disorder, both of them probably evoke the same different strong countertransference, right? Like it's all it's all part of the process, right? And you will, in the process of doing therapy, I think more emotion is evoked in you than maybe you were aware existed, right?
And that's why every one of the, we now have several evidence-based treatments for borderline personality. Evidence-based meaning they've been studied in controlled trials, and we know they offer help. Every one of them emphasizes the necessity of consultation, supervision, support for the therapist, because there's a recognition, we're going into really turbulent waters,
Yep.
like there's
100%.
a big waves coming, and you don't want to go it alone, and you want somebody else to be able to, right? When you think about mentalization or reflection about your transference, of your countertransference, you want somebody else to be able to help you think about it and say, perhaps you're feeling this way, because, and right, you need somebody else to kind of help you separate yourself from the projective identification, the thoughts and feelings that are being evoked in you, and help you find your way back to a place where you can think your own thoughts and say, how can I understand this? What's going on?
Yep. Yeah, that's really good. It's like I until you are able to do this deep work, you may not even realize the need for a good supervisor. But then you just inevitably do very, I don't know, superficial work, or like, you're teaching them mindfulness or something very like,
Which, yeah,
coping
which
skills or
which is, which might help stabilize somebody in the midst of, who's affectively dysregulated,
sure.
but it's not
Absolutely.
addressing the underlying psychological structure that's making them so vulnerable to repeatedly getting dysregulated.
Right. Like they did there was one study on transference focused therapy, which is kind of what we're talking about today,
Mhm.
versus dialectical behavioral therapy. Both of them did very well treating borderline personality disorder. Both of them highly, you know, good evidence-based treatments, but the transference focused therapy group improved their reflective functioning a little bit. They improved their
You're
ability to
thinking of the
attach.
study. Yeah, you're thinking of a study. The lead author was Ken Levy, and it was a comparison of transference focused therapy with DBT, and when they looked at just external measures, like things. It's been a while, but as best I can remember, things like you know hospital admissions, emergency room visits, suicide attempts. In the in the immediate short run, both therapies were helpful, right? They reduced
Mhm.
these harmful behaviors. But what they found in the transference focus group, which is to say the psychoanalytically oriented therapy, is that two things happened. One is people's attachment styles changed. And so people were moving from um, insecurely attached styles, avoidant or anxiously attached, to more securely attached styles. In other words, they were developing something that could change their lives on an enduring, ongoing basis. We're taking people who really couldn't, you know, consistently connect with other people, right?
Hmm.
Ultimately, what's really stabilizing, right, is, you know, we're not going it alone. This is that we feel
Mm.
connected to others. We're taking people who didn't have that in their lives and giving them that capacity. And then hand in hand with that were changes in reflective function. Reflective function is the name of the research scale that measures the concept of mentalization, which is to say, they were not continuing to equate their feelings and their perceptions with external reality. They were developing the ability to think about it, to place it into context, to call them, to call their own perceptions into question, and therefore to act differently in the world. So there were things that are sort of life changing. And I don't recall that this was got a lot of airtime in the literature, but my understanding was that the benefits of DBT began to decay over time, right? They kind of, you know, like the maximum benefits were at the point when therapy ended, and then the gain started to slip away. Whereas in the transference focused or the psychoanalytic
Mm.
therapy, the gain seemed to endure.
Yeah, I'm not. I'd be curious to look at that second piece if you have that research. We'll put that in the article, and yeah, we got to bring it together here. So, okay. Any final thoughts? Um, any summations?
I guess I'm just making a case to remember that human beings don't exist in, you know, black and white categories of heroes and villains and victims and oppressors. We're talking about human beings, you know, not storybook characters. And, you know,
Yep.
being a human is complex and nuanced.
Okay. Any word for the person who keeps commenting on all my YouTubes? Where's Jonathan Shedler? Bring Jonathan Shedler back. You have some people idealizing you out there.
Well, I was just going to say they sound like a very, you know, thoughtful and discerning individual.
Yeah. Oh man. Okay. Well, there you go.
I hope this
You
lives
are
up to the
encouraged.
expectations.
Every YouTube I post in the future will probably have multiple of those then. Okay, thank you.
Well, it's been yeah, it's been fun. It's
It's been
been
fun,
fun
yeah.
discussing these issues with you.
All right, we will leave it there for today. And yeah, if you want to have Jonathan Schiller back, you'll have to tweet at him, incessantly.
Oh, they should direct all the clamoring at me, not you.
At me, right? Okay. All right, we'll leave it there for today. Thank you.
Thank you, David.